So, Dr. Tony Gerk, a family doctor in Sterling, Colorado. How long have you been there?
Uh, Almost 9 years. It'll be 9 years in September. I started part-time. My wife was finishing CRNA school in Texas after I finished residency, and so I moved and started working part-time in September of 2011, and then we moved here in January 2012.
Yeah, and I think I met you right after you had moved.
Yeah, yeah, I think so. Yeah, it's been a while.
So it must have worked out.
Yeah, it's been great. I worked. Dr. Curtis Clark started this practice,
Right.
Northeast Colorado Family Medicine. Oh gosh, 44 years ago.
Yeah.
And so I joined as an employee for 2 years. It worked out great, and then bought half the practice, and then Dr. Clark retired 2 years. It'll be 2 years in
Hmm.
September, and then so still here, and there's three mid-levels here with me, two nurse practitioners, a PA, and then we just hired a new physician who started last week, Dr.
Oh,
Kyle Schwinn. So
congratulations.
yeah.
Where'd you find your physician?
Well, it's funny. So he was here for 4 years. He came to Sterling after he finished residency in Wichita, Kansas,
Hmm.
and then worked here for 4 years in Sterling. So worked with him as part of the OB and family medicine call schedules. And then he and his family went abroad a year ago. They thought permanently, and then they kind of got kicked out of their site when coronavirus hit, and they kind of decided being abroad permanently wasn't necessarily what they wanted to do for their family at least at this point. So he came back and called me like the beginning of April when things were absolutely at their worst from a coronavirus standpoint. I mean, we were seeing five patients a day in our office, something terrible. And he said, "Do you have any job opportunities?" And I thought, oh my gosh, you couldn't have called it a worse time. But really, to be have somebody that does all the same things that I do. He does OB and endoscopy. Can do the pediatrics and inpatient stuff that we do here at Sterling. Somebody that I worked with for 4 years. I knew that I could trust immediately in the office with to be
Yeah.
gone and that sort of thing. It was never it kind of a once in a decade opportunity, really. And so we realized it doesn't matter what it takes. We got to get him here. So he started last week. It's great.
Good choice.
Yeah.
Good. So you understand this is to be a conversation. Uh,
Right.
oh, by the way, today's July 16th, 2020. Need to get that in the record. Um,
Yeah.
so although I sent you that list of possible questions, it's really just to give you an idea of the ballpark of the conversation. But it really, as we
Sure.
learned early in medical training, there's nothing like sitting down with a patient, although many doctors forget that. Sitting down with the patient saying, "So, how's it going?
Right.
How are you doing? So, how's it going?"
Yeah. It's so weird right now for us because um, I think we've returned almost to kind of a normal patient volume now in Sterling,
Hmm.
um, but we still have this there's this just kind of undercurrent of anxiety and weirdness because you know it's hard to know if are we going to see somebody who has COVID and that's going to potentially infect other patients. What if one of us gets it and our whole office gets it and we have to shut down the practice for 2 or 3 weeks. But we've seen so little of it in Sterling over the last 5 to 6 weeks. I think there's only been 3 cases in Logan County, something really small,
Wow.
over since about mid-May. So we kind of feel like it's passed us by, but then we're also worried, just like everywhere else. Is there more to come? Is there another wave coming? So it's really hard to know, and there's everybody's there's varying degrees of skepticism, just like within the whole country. If it weren't for the prison here in Sterling, we probably would have only had 60 or 70 cases in the whole county. And so there's a lot of folks who feel like, well, it's just different here. We don't live
Hmm.
densely. We don't shop densely. It's a lot more spread out. So are we not going to see the same kind of numbers that we're seeing in other places? But then on the other hand, you say, who knows? What if we do just it's just delayed, like we're seeing in Texas and in Arizona, and we're just going to be late to the party. So things are good. I think our practice financially is okay. We were really worried in April and May about, what if we continue at this kind of low volume And so, but we're doing fine. We still kind of allow people to decide whether they want to come in to see us. And so if folks aren't comfortable, we try to say, well, please stay home. We really are seeing hardly any sick people in our office. Anybody that we have really high suspicion for COVID, we actually just see them in their car. And we start doing that. We realized after we brought a couple sick people in early in this whole process and realized what that potentially does to your office, that you have somebody coughing and hacking through your whole office and that sort of thing, and how many people are you exposing, it just wasn't worth it. And so people that we're obviously really worried about, we just send straight to the ER. And then everybody else, we do a little car visit, and we get all gowned up and we go out and talk to them. And you can reach in and listen to their heart and lungs a little bit. You can take their temperature, and you can do a COVID swab, and then you get the heck out of there. And we found that we can do a pretty good job. Only expose one person, not expose the whole office, but still take care of folks. And so that's kind of what we're doing. And it's remarkable how little viral illness there is right now. I mean, even in a normal summer, even though it's low, you still see some colds and strep throat and that sort of thing. And gosh, we're just seeing no sick visits. It's really just the strangest thing to see no sick visits at all.
And you're off, have you had to lay off any office staff during this time?
We did not lay anybody off. We kind of committed early on to doing everything we could to not lay anyone off. And then we were lucky to get a payroll protection loan / grant. And so that helped us through. Medicare, gave some prepayments for folks that see Medicare. And so we were able to kind of weather the storm. And I think now we're through it. We were really worried about how our accounts receivable, in medicine are about 3 months behind because it takes long for payers to pay. So we were really worried about right now, July, August, how are we going to be doing? And it turns out we're fine. We kept busy enough, and luckily I do obstetrics, and the babies didn't stop coming during this pandemic. And so that we kept our revenue even enough to not have to lay anyone off.
Have you done telemedicine?
We did. Yeah, we did. And so we're still doing it to some degree, varying degrees of success. Some of our older folks that really probably would have benefited from it the most had the hardest time kind of navigating it and figuring out. When we were able to do telephone visits, that actually was really great, when we could just say, hey, we're just going to call you, especially for those chronic disease type of visits. Most of the time, diabetes and hypertension management, we'd have them sneak in early in the morning and get some labs drawn. And most of them have a blood pressure cuff at home, and they can tell us what their blood pressure is and their blood sugar. And you're able to do a lot of medicine over the phone, it turned out. It didn't replace the seeing them, and conversations with them and that sort of thing, but it allowed us to get by. And sick visits are hard for your telemedicine. It's really hard to know what you're people are. It kind of sounds like you're telling me you have a sinus infection. I don't know. I can't really see your tonsils. Maybe you have. So we did the best we could, and we still got it. We were lucky. We got a new EMR last fall, and so we were just able to flip the switch and activate telemedicine for our office. And so that was great.
So so by telemedicine, I mean both video and also plain old phone calls.
Yeah.
What percentage would you say of the care at a distance you've done by phone, and what percentage by video?
Yeah, I'd say now we're maybe less than 2% is phone or video now. I don't know though if I should say that. I guess the other thing is billable visits versus we're doing phone care for people that maybe isn't reimbursed, because I think there are still some folks, some higher risk elderly folks that we just don't feel comfortable bringing into the office yet. And so we're still doing a lot of phone care with them, and hopefully Medicare is going to reimburse some of that. I know that there's some question about whether they're going to continue to reimburse just the telephone only visits now, but at the peak, I'd say, from about mid-April till mid-May, we were doing about probably 15 to 20% of our business was telemedicine. We had a lot of people who just wanted to reschedule, and we didn't force people to do telemedicine. If they said they just wanted to hold off, there was nothing acute going on, they were just due for a wellness visit or a blood pressure check or something like that, we didn't tell them that they had to. We probably could have, and obviously if this would have persisted for a long time and financially we needed to figure some things out, we probably would have told people they had to do telemedicine or not, but we just gave them the choice. And so a lot of people just elected to say, I'm just going to hold off and I'll schedule when things calm down.
What do you feel for those patients who you saw by video? What do you feel that having the video added to or did it add anything to the interaction?
Mm-hmm. I think it was very convenient. There was, for a lot of people, they really appreciated it. They liked it. They could talk to a couple, gentlemen and just sitting at their desk in the afternoon, and we kind of had a nice conversation about their health. And so I think from a convenience standpoint, it was nice. I don't know, did it make our provision of medicine better, or did we provide better care? I think to me, it was a little bit more of a stopgap than replacing that chronicity of care, and that it was not for me a replacement for that doctor-patient relationship that's so important.
And how about video versus audio only? Do you feel like that enhanced your interaction?
I felt it did, and I think patients felt it too. If I could see them, just like I'm looking at you now,
right?
This is a much more it seems to be much easier conversation than just over the phone, especially when you kind of, they have some complaints and that sort of thing, and you could kind of say, well, I can see you're not feeling real good, or tell me, you don't look quite as perky as last time I saw you, what's going on? And that was, I also think, I did a lot of nursing home visits. One of the nursing homes here in town was able to set up some telemedicine for their residents, and that was great, because those folks who hadn't been able to see any outside visitors, and I wasn't able to get into the facilities to see them, I think it was really, really great for them. And they, they had big smiles on their faces when you were able to see them and talk to them, and they're just amazed at the technology, a lot of them, that we could do.
I think especially for homebound people, the video adds a whole lot, that presence.
Yep.
Sure. Have you had any COVID disease in the nursing homes?
Zero here in Sterling, knock on wood.
I'm knocking on wood as we speak.
Yeah, I know. I do every time I talk about it. They did a really good job of keeping folks out. They cohorted people really well. They were really careful with their staff. And I think there was some luck involved too, that we didn't get, like in a lot of the places, Greeley and that sort of thing, where they got an early staff member that came in with it, and before they even recognized what was going on, and it run rampant. And I think we were lucky here that that didn't happen. So no, they've done a great
job. Let's talk about, so you said you've had your business in terms of visits is almost back up to what it was before. And you said, but it's not much acute stuff. So I assume that's more of your health maintenance and chronic disease care. How do you feel like your patients got through the chronic disease part of the practice during these times?
I think for us, it was a short enough period of time that we were able to just kind of, help people along. They kind of limped through it a little bit. We could really feel, though, like that by the end of, especially for our, some of our more acutely ill people, the folks with heart failure, the poorly controlled diabetics, some of the more needy patients, just to be perfectly honest, you could tell by the end that we really needed to get them in. We really needed to see them, because somebody can tell you they're having heart failure symptoms, but boy, that's really hard to, without accurate weights and seeing them and seeing how they look 2 days from now compared to what they looked like a week ago. You just can't replace that. And so I think we did okay, but we would have come to a point, I think, had our kind of very strict lockdown and decreased patient volume continued for another 5 to 6 weeks, I think we would have probably started to see some real, compromised health in some of those folks.
Oh, I went back to the issue of telemedicine. There was a question I forgot to ask you. Given that Sterling is embedded in a very rural part of the world, how about issues of just connectivity?
Hmm.
So were there people, for example, who you try to do a video connection and you just didn't have the bandwidth for it?
Absolutely. I mean, there's very little fiber optic internet in Sterling to begin with. And so there was definitely connectivity problems. So you'd get on and it'd start skipping. And you know, the other thing that it was just remarkable is that when school was still in session and when all those kids logged on to the internet and people working from home too, you know, from about 8 in the morning until noon, I mean, things were just moved at a snail's pace. And so we kind of stopped even trying to do much in the way of telemedicine unless we had to in the morning because the internet connections here were so slow that we just couldn't do a whole lot. But there were definitely some of those visits. You know, you'd talk to them and you'd try and they couldn't connect, or they'd get disconnected, or the video didn't work, or they're talking but there's no sound, and then we just hang up and call them and say, well, we tried. You know, let's just do this over the phone.
Mm-hmm. How would you say? Of course, there's always a wide range of responses, but how would you characterize the community has done and is doing now in the face of this?
You know, I think it's hard to know. There's so much going on right now in the world, you know, and so I think the community response here was good. So if we just talked about how did the local governments respond, how did our local hospital and hospital administrators respond, our schools, I think everybody did the right things at the right time to kind of keep things under control and to not and to kind of keep the community at least semi-happy. Now I think we've got such a pushback against any restrictions on people's liberties that any attempt to kind of pull back, or you know, when events are canceled recently, they canceled the county fair is the second week of August, and they just canceled the parade, you know, the last weekend. It was just this uproar, you know, how could you guys do this, and it just doesn't make any sense, and let's just call it a protest and then we can have our parade and all these sort of things. And so you know, there's some unrest now, I think, about what's the right thing to do. And you know, that's such a bigger topic, because who do we trust? Who do we listen to? Who are the experts? Who aren't the experts? Who's giving us the right information? It's really difficult, and things change all the time. And for me, that's been the biggest struggle. Is I think that there's a lot of folks who have a distrust for medicine in general now, you know, even before this all started, you know, just kind of these guys know what they're talking about. They're just and so now when we're we're changing course all the time about, well, now we need to do this. Well, now we should wear masks. Well, now we shouldn't. Well, now we're seeing people on the office. Now we shouldn't see people in the office. Now we're not going to have people in the waiting room. Now we are going to have people in the waiting room. And so I think it's unfortunately bred more distrust into this kind of medical public relationship than we had before. And so, you know, we have a lot of people kind of scoffing at us when I go in a room wearing a mask, you know, and we're not forcing our patients to wear a mask. You know, I know we could, but we've told people, if you're comfortable wearing a mask, wear a mask. We're not going to kick you out if you don't wear a mask. And I tell people, I'm going to wear a mask, because if I'm doing your C-section, you probably would like me to wear a mask. And the reason for that is because it decreases the spread of infection, right? And most people agree with that. And so I just tell them, I don't know what I was exposed to yesterday or 2 hours ago, and I don't want to expose you to anything. And I think when you present it that way, people are receptive to it. But people really don't like being told what to do in this part of the world. And so when we are trying to tell people what to do, it's really a struggle. So I don't know. I hope that we can find some good unity after this all passes us by, and that people kind of come back together and realize that what a strange time in history this was, and recognize just that it was kind of unprecedented, and people were just trying to do the best that they could in most situations.
So as a summative statement about that, would you say that this pandemic has brought more discord than community?
Yep, 100%. I think I feel more discord now than before, without a doubt. And part of that might be just because, do we trust local officials? Do we trust our doctors? But also part of that is these small towns are very community based. I mean, we get together a lot and we know everybody and we see each other at restaurants or the sale barn, or we have a concert series in the courthouse square called July Jams for 4 weeks in the summer, and you see people, and now we're not seeing people. And so there's this real sense of like, well, I don't really need to see anybody anymore because I've been home by myself for 3 months and maybe I just don't need anybody. And that, the kind of that sense of community that we have in small towns, when that gets compromised, then that's one of our strengths. And so that to me is kind of a sad situation, but I don't think it's irreparable. But I don't feel the sense of community is the same as it was 6 months ago.
And has it been that way from the start, or did people start out together? Oh, we're all in this battle together, and then it's fractured.
Yeah, I think that. It was so funny. So it was a Thursday afternoon, probably. I don't know. It was the week after kind of our shelter at home orders started, and it was a Thursday afternoon at like 5 o'clock, and I was leaving my office. I was the only one left in our medical office. There was nobody here. The hospital's kind of in one of the busier neighborhoods here in town in Sterling, and I pulled out of our office. The hospital's right across the street. I saw not a car. I drove down, took a right, and came to one of the busier intersections around the hospital. And I looked both ways. It's a long road. I didn't see a car in any direction. I looked straight ahead of me through the neighborhood that I was going to drive through, probably 40 houses in front of me. Not a kid on the street, not a bike on the sidewalk, not a car moving. And I just thought, how strange, but how seriously had people taken it at that point? People really were at home and they felt that was the best thing to do and they were willing to do it. And now it's just the opposite. I mean, you go to our stores, people aren't wearing masks, and I don't think people are dangerously getting together in huge groups and stuff like that. But people have really said, we're not gonna do that anymore. And I worry that we just did it too early. Maybe we just did shelter in place too early in some places, and maybe we should be sheltering in place now. But
well, it's resurging in plenty of places.
Right. So
though not small towns, except for their animal processing plants and prisons and nursing homes.
Right.
So you're probably still pretty okay. I was in Greeley. I was shopping at King Soopers here this week, and I would say of the customers, only 20 or 30% of the people were wearing masks. And Greeley's a city, and we have plenty of it in our beef plant here and in the nursing homes and in the jail.
Right. Yeah.
Here we go. A technical question. When you were talking about how you do things at the office, you have reopened your waiting room?
Limited. We still suggest people don't stay in the waiting room. We have a pager system that we kind of implemented early on. So we tell people we prefer to give them, if they walk in to check in and we don't have a room ready for them, that we prefer that they take a pager and go wait in their car or outside. If they can't, and especially for the folks that have a hard time, some of the elderly folks that had a hard time getting into their car and into the office in the first place, then we were telling them, now you have to go back to your car. So we just have 5 or 6 chairs in our waiting room, all spaced apart. And so we tell people they can be in the waiting room, but we try to minimize, how long they're in there and get people back to rooms as quickly as possible. So it is open, but I'd say limited capacity.
Yeah. So you talked about morale in town, and you mentioned that there's this ongoing anxiety, just not knowing what's in the future. How is morale in your office?
I think morale in our office right now is great. I mean, we have, part of it is I think people can look around and see folks that have lost their jobs. We have a lot of kind of oil field workers here and oil industry. And so with that industry taking a huge hit, there's a lot of people who've lost their jobs. And so I think most people recognize and are thankful for the fact that they have their jobs in the same form that it was 6 months ago, and their pay has not changed and everything's the same. I think we also kind of from the very beginning said, we're kind of like, the classic statement that went around, we're in this together and let's figure this out together. And we met our whole, I mean, we're lucky we have a small office, so 12 employees total. but we met every week to talk about what's our plan for the coming week, what's working and what's not working, how should we do things differently. And everybody talked and everybody had input, from the receptionist at the front to the physicians and the nurses. And we just tried to all sort out and come up with solutions together that were going to allow us to take care of our patients, and also for us to stay sane and to keep the office, semi above water. And I think I think now that that's showing, that since we were able to do it together, it wasn't, we weren't dictating what was going to happen. We didn't have an administrator coming in, walking in, telling us this is how it's going to be, and then walk out the door. And so from that standpoint, I think it brought our office closer together. We had some rough patches. Don't get me wrong. There were a couple meetings that were a little heated about people who didn't feel like we should be shut down to the degree that we were, that we were, potentially compromising the health of the practice long term by seeing so few patients, that we were overdoing it, and we were scaring our patients by making them do all these things. And so we definitely had some things the meetings where we had to work through it, but I'm so glad we did, because I think it's just like everything. Most of the time you work through the conflict, you're going to come out stronger on the back end, and I think we did. But it could have easily gone the other way, and I see how certainly in some bigger practices, where it was more things were dictated to you rather than coming up with decisions, that those places unfortunately aren't necessarily in the same boat as we are.
Back about 100 years ago, when I left my private practice, which was in Wisconsin, to come work at the residency here, the hardest thing about it was no longer having the control to make things work, having to. Yeah, so it sounds like you guys have done a really good job. Maybe you can serve as a beacon for the community of the effects of collaboration.
Yeah, and I hope so. We work pretty closely. I the hospital here and the hospital clinics, and so we've all tried to share kind of what we're doing and how we're doing things, and so hopefully it helps. It's hard. We've got us, and then there's a Salud clinic,
Mm-hmm.
and our health clinic, and then a UC health clinic. And so those places all are pretty much controlled from quite a distance. But not that there's zero local control there, but trying to help them say, oh, maybe there's some other ways to do things, or have you thought about doing that? And so hopefully we've all kind of helped each other out.
Well, one of the I also found from being in practice, my own practice, one of the hard things, of course, is if you don't belong. Some of the time, you'd like for somebody just to tell you, with the fire hose of information that we've had from the very outset, and much of it conflicting, and all of it changing. How have you navigated that? Where have you gone for information and for your protocols?
Yep. That was extremely difficult, especially early on, because nobody knew anything, and then so we got there was a lot of guidance about this is what community members should do, but what do clinics do? And so I relied heavily on two things. I relied on I thought the AAFP did a fantastic job, and the AFP journal, the practice management journal, was great. They had a few really good articles early on, where they kind of talked about protocols for your office and how you should be running things. Also in the AFP, the interest group chat rooms. I don't know if you are involved in any of those, but there's the rural health one and the private practice or practice management. I can't remember which one it is, but a small practice interest group. Anyway, whatever those are, those were extremely helpful, because those were folks from all over the country kind of chiming in about what they were doing in their small office and how they were handling things. Mm-hmm. And you were able to see kind of a variety of different settings, people that were in the middle of Seattle versus the middle of Nebraska, and vastly different prevalence of the disease and that sort of thing. But those things were I thought, for me, helped guide us better than anything. We used Banner. I think, unfortunately, some of the larger hospital groups just lagged behind, only because there's some inertia there. They had to get kind of everybody motivated and mobilized, and get the committees together and then make the decisions. And it kind of seems like sometimes when they would put something out, it would be like 2 weeks too late. But we still did. I reviewed all the outpatient banner protocols because they sent those to us to kind of see how they were doing things, and also because we work so closely with the Banner Hospital here, we knew we needed to kind of,
Right.
not be totally out in left field as the way we were doing things. So I'd say a little bit of Banner, a lot of AAFP, and then just a whole lot of us, putting all our heads together and deciding what's the right thing for our practice to do.
Mhm. And how is the hospital doing?
I think the hospital's doing pretty good. They've kind of picked back up. I know we had so I'm on med exec over there, and so we had a meeting. It wasn't this past month, but the month before, and April was the first month that this hospital had posted a financial loss in I don't know how many years, and so to be expected. But the things have picked back up. We're doing quite a bit more in the way of elective surgeries. I did 4 endoscopies today, so we're kind of getting things moving over there. I know the general surgeon had 4 cases when I was doing endoscopy, and so things are starting to pick back up a little bit. One of the things that we thought was so interesting is how empty the hospital was. They had the COVID unit open, and especially in March, April, when things were, there were a fair number of cases here. It seemed like the rest of the hospital was so empty, and so we all talked about, where are all the bowel perforations and the the bowel obstructions these old folks that come in, or where are the and it was understandable that there was no influenza. That to me was one of the most remarkable things. We were seeing a lot of influenza at the end of March. Still 4 or 5 a day here in the office. It evaporated in 10 days. I mean, it was, we sheltered in place, and that it was gone. And so that was pretty amazing. And so maybe there just wasn't as much, other than COVID, there just wasn't as much kind of upper respiratory infections circulating and bowel viruses and stuff like that. But we were just amazed at how few people were in the hospital, because it seemed like those things should still be going on. There should still be COPD exacerbations, and but they just didn't seem to be. And so that was an interesting thing. But
and coronary artery disease is not contagious. I mean, except by lifestyle.
Right. Exactly right. So that was interesting. But now I think certainly on the upswing now, across the street.
And how are you holding up? Well, first of all, I just wanted to comment when we were talking about it at the beginning, and you need to get the protocols in place. I remember, and also my practice back in Yuma, even before Wisconsin, in the National Service Corps, what it was like for me being in a new practice where I might see 5 patients a day. And so I spent the time organizing things and doing protocols and getting patient education materials together and stuff. So at least you had that when this was starting. You weren't one of those people who was overwhelmed with scary, sick people.
Right.
But so how are you doing now?
I think there was so much to me. It's kind of like you said, we were so slow, but I felt so busy during that time, trying to figure out what to do. And there's a lot, it's just a busy, I think my life is really busy right now in general, between practice and home life and those sort of things. And so there were some very stressful weeks, I would say, for me personally, in April and early May. You worry about come to work and see these 12 faces that are essentially depending on you for their livelihood and their jobs. And there's not, we're not in the middle of Denver where you just go out and get another, an MA just doesn't go out and get another job in a clinic. And so to know, to question whether you're making the right decisions, am I doing the right thing by slowing down? Should we be seeing more people? Should we be doing something totally different? Should we be closed altogether? Should I be laying people off? What if the practice goes under and because I tried to keep people employed and keep paying them? What if I in the end I cost people more than what I would have if I'd have laid them off for 4 weeks? And so I had a lot of waking up in the middle of the night moments, which I do that occasionally, but I'm generally not a real worrier. But I had a lot of worries, I would say, in April and May. And then I think, you just kind of, hopefully, if you're working through things in the right way, for all of us, you start to see some clarity and some light at the end of the tunnel. And so that for me, seeing our office really coming together and everybody being on the same page, not fracturing, and everybody feeling like we were doing the right thing, seeing our patients be thankful. I mean, that was the other thing. People were so nice to us. I'll probably get emotional talking about it, but we didn't, I mean, we did so little from a coronavirus standpoint. I mean, we tested some folks here and we tried to do our best, but the only way it affected us is we slowed down truly in my practice. Like our patients were wonderful. I mean, they sent us lunches and they brought us things and some of the nicest cards we've ever gotten from people and flowers and all this stuff, and people were trying to support local businesses too. We did some of that too. And so they were trying to keep the flower shop going and some of the restaurants. But those things were just so reassuring, and kind of validating for why you work and live here and do all the things that we do day to day. So for me, by about, I'd say early May, I started to kind of feel better about where things were and that sort of thing. And so, now I feel great about things. I have a little bit of worry about what would happen if things worsen again, but I also feel like we're kind of prepared. Everything was so unknown in February and March. We didn't know, what donning and doffing PEE, or PPE. The first time we talked about that, people were, what do we do? And now it's almost like second nature. Everybody slaps their masks on and we go to work and the whole place gets fumigated and wiped down twice a day. And it's just part of our routine. Right. And so I really do feel like even if we have another surge here, we can handle it. We'll slow down again a little bit. And, but we're not incapable, and I think in early on, a lot of us felt incapable or helpless, and I don't think we're helpless anymore. And so that to me is pretty empowering to say, we can do this. We've got a really good medical system. It's not perfect, but if we can do it if we need to.
That's the love. That's the loveliness of an independent small practice.
Mm-hmm. Yeah.
There's a resiliency.
Yeah.
Scary thing is, of course, like you said, but there isn't reserve.
Yeah.
Now you've got a second physician.
Right.
So you'd have to have two knockout punches.
Right.
But that's really scary. How are things at home? I don't know about your family.
Yeah, so my wife is, she's a nurse anesthetist here at the hospital.
Uh-huh.
And then we have 3 children. Our oldest is 7 and our youngest is 2. And so she actually, there was 4 CRNAs here in Sterling. One of them got furloughed very early on. And then the other 3, they just cut their pay in half. So really we saw a quarter of our income just kind of evaporate in a week. Mm-hmm. And we're in the midst of building a house, of course, and lots of other things. So just how all this goes. So there was some home stress there, but the same way, you got through it, and quickly the hospital picked back up, and it wasn't we recognized that thankfully Lauren wasn't going to lose her job and all those sort of things. And so there's ways that I think we've become really, our family's gotten closer because we've spent so much time together. I mean, my gosh, the April and May, we didn't even leave. We didn't go. And I was petrified to take my kids out in public because I thought, my gosh, if I bring something home to them, are they going to be these little typhoid Marys running around town, Mm-hmm. And so, and because I didn't isolate myself from my family. We luckily live outside of town. We don't live close to folks. We live in the middle of nowhere essentially. And so we were able to keep our kids there. And so I came home and I stripped my clothes off and put them in the washer. And then, I was with my kids and my wife. And my wife was the same way. When they had to intubate COVID patients, she was they had the CRNAs come in to do it. So it was impossible for us to both completely avoid it. But I was petrified of our kids then, being asymptomatic and giving it to my parents or community members. So our poor children did not, I think they were in a car twice from late March until late May. I mean, they really never left. Luckily, there's plenty of places for them to run and roam there. But that was, in a lot of ways, it was fantastic. These weekends, we were like, we have nowhere to go. We're not on call. Sometimes we were on call, but we just have to be home together, and it was really great. Our daughter, our oldest, really needs to get back to school though, because she's been at home with her parents and her 4-year-old brother for so long that she's she might, she might flip out here at some point. She really needs some
Has she started
kids
wetting
around
the bed
age.
again? That's
Yeah,
a bad sign.
exactly. Some regression. Yeah. She's just counting the days. She goes to the Fleming school, and they announced her starting August 13th. So she's already started her countdown. She's crossing off the days on the calendar, and she's so excited. So,
Yeah.
there's it's a lot of family time. It's a lot of face time, but overall, I think we've done great. We're really thankful for where we live. I feel so bad for people that live in the middle of cities and we're quarantined to apartments and stuff like
Yeah.
that. And we're just so thankful that we live where we do, and our kids were outside all the time and all that sort of thing. So we've come through it really well, I think.
I've got grandkids who are 3 and 4, and they have been thrilled, although they both miss preschool, but they are thrilled to have their parents full time because their parents are able to work from home. So
yeah. It's funny, they've got this thing now. The 7-year-old and the 4-year-old now. This, we'll talk about why we can't go somewhere, or why something is the way it is now, or why we can't go to the pool. They just both, will say, well, what is it? Why do you think the pool is closed? And they just, oh, Corona. And they're like, yeah, Corona. It's Corona.
Well, you know what? We're doing this, hopefully, an archive that will last a long time, and it will be public. And so your kids and grandkids, God willing, will be able to come back and look at this and watch your interview about what was going on and what was going on in their lives at that time.
Yeah,
We're going to, we've talked to one video production company, and we're going to get all this stuff kind of cleaned up and indexed, and hopefully it will, and we'll do a with some salient excerpts, and we've got, I think, almost 70 now done, and hopefully get it out there and get it marketed, and hopefully researchers will use it, and historians and curious children and grandchildren, to get it out there. But it's been a fun thing to get to do. It was hard for me as a retired guy when this happened to stay on the sidelines. But this has been a good thing to do, and I give a lot of people advice for nothing. So
yeah, there you go.
It doesn't pay, but I'm okay.
Right. Yeah, I think it's great you're doing it though, because these oral histories are important. I mean, it's telling these stories, and gosh, who knows how history is going to look at this 2020 year, but to have this, for us, at least for our area, I think it's great.
Yeah, I feel that this is a turning point. Where we're turning to, we don't know, but this is one of those times that it affect everybody in our whole culture for a long time.
Yeah, absolutely. It's kind of it's definitely a bottleneck, and then how are things going to come out on the other side? It's there's certainly going to be things that change in our practice about the way we do things. I think some things for the better, and so it's okay. But yeah, boy, it's just so, to me, it's so interesting. The social interactions now are so interesting when you go out in public, and how quickly we learn to distance ourselves from people. And when people get too close in the grocery store, you just bristle immediately. And we sort ourselves out. We go to, we went to just going to church. We just noticed, and it's cordoned off in certain places you can sit and camp, but people just are automatically, isolating themselves and segregating themselves. It's just amazing to see. I mean, how quickly we can change our habits and our culture in a few months if we need to.
Right, and that sense of personal space is one of those things that's almost innate. It's so deeply embedded in the culture.
Right.
That's just changed just like that.
Absolutely.
Yeah. What do you think is going to be different in your practice here on out, given what you've learned? So when this is all passed, but you're still going to be following some lessons you learned during the pandemic.
I don't think we're ever going to bring acutely sick people into our waiting room again. It's kind of amazing that we did that anyway. And we always joked about, the poor guy comes in for his blood pressure check in February, and then he sits in our waiting room, and then we see him for his 10-minute blood pressure check, and then a week later he's back in with influenza, and you're like, oh my gosh, I wonder where you got that.
Yeah.
But I think it was really true, and so this pager system has worked out great for us.
Yeah.
And so I think really trying to kind of isolate when and where we see sick people, and how we bring them into the waiting room. That's one change that I don't think will go away. I think that just made sense. I think our kind of our cleaning protocols and the way we, our personal protective equipment in small private offices is kind of not necessarily something that was high on people's radar. You don't have JACO, reigning over you, and so you kind of do things the way you want to do them. And there are certainly things that we could have been and should have been smarter about in disinfecting and cleaning and mask wearing and gloving and all those sort of things. And so single use, items and that sort of thing. So I think from that standpoint, we'll be better. I think those would probably be the biggest things.
From the beginning, if you had it to do over again, are there things you would do differently?
I think I would have probably taken our staff's opinions of the I don't know. It's hard to say because we're learning. I want to say that I would want to know how our staff and our patients, for that matter, feel about the virus itself. Do they feel like it was dangerous? Did they not feel like it was dangerous? Did they feel like we were doing the right things? Did they feel like this is all just a hoax? How did they feel so that we all had a? But at the time, it's funny. It's hard to go back to that point because it was so unknown. And so I don't know if it would have changed anything we did, but I do think that there were times when I probably, in some ways, minimized how some of our staff and patients were feeling about the legitimacy of how bad or dangerous this was. And I just kind of wrote them off and like, you guys are nuts, this is a bad thing, and so probably figuring that out from the beginning and then understanding where those thoughts were coming from probably would have helped me not be so surprised when that stuff started to really bubble to the surface a month or so
address
ago.
those things from the outset.
Yeah, exactly. And we tried, I think we've got a pretty good Facebook following for our practice that we post on and that sort of thing. And so, early on, I kind of wrote a long thing about what I kind of thought we should be doing, what our practice response was going to be, and that was kind of well received. And we tried to tell patients when we called them to reschedule them, but I think we all could have done a better job of that. From me and Sterling to the people making big time decisions in other places, to really listen to the people and figure out why do they feel that way. Are we not listening to them? And if we are listening to them, why are we not responding to them in the way that they're asking to be responded to?
When all else fails, listen to the patients.
Yeah, absolutely.
Just back to doing things differently. I meant to ask this before. How much do you think telemedicine, including telephone, will be a part of your practice compared to what it was before?
I think it'll be. Yeah, I think it'll be a permanent part of our practice now, whereas it was one of those things we always thought we were going to do. It was kind of we'll do it, we should do that. We need to really look into that. And I think now it's kind of ingrained. And I don't think we need to worry as much about, our snowbirds that go to Arizona in the winter and we kind of lose track of them for a few months and they maybe try to find a doctor when they're down. Well, now it's just do a telemedicine visit when you're down there. I can send your prescriptions to Walgreens in Phoenix as easy as I can send them to Walgreens in Sterling, and so I think some of those things will always be there. I do wonder about how, if our patients will, and our providers for that matter, will tolerate that lack of personal being in the same room interaction if we made telemedicine, not necessarily a requirement, but if we were doing a third of our visits via telemedicine, would we all still have the same job satisfaction? Would we feel the same kind of empathy for our patients and the feeling of doing good that we do now if we're just talking to them over the phone and video? I don't know the answer to
Remains to be seen.
those things. But those are the things that worry me about going to rely too heavily on telephone or telemedicine visits.
And maybe especially in rural practices, I mean, just in rural places where everything is, much more personal and face to face.
It is. Yep.
That's.
We had a couple patients who were just almost appalled that we were calling to reschedule their appointments. They just couldn't believe it. And then we had one lady call us back, and at one point we just said, pretty much everybody over 65, we were going to try to reschedule. And she thought that we weren't going to see anybody over 65 in our office anymore. So, she was really worried, do I need to find a new doctor? And we're like, oh, no. This is for the next 2 weeks. And then we're going to call you again and we'll talk about where things are at that point. And, but, oh yeah, people are very disconcerting for some folks.
So so you were thinking of switching to a pediatric practice, right?
Yeah, right. Exactly. Yeah.
Which
Exactly
in a rural area is limited to people under 65.
That's exactly right. Exactly right. Yeah.
All right. Well, anything else you'd like to say? I mean, remember, this is for your grandchildren.
Yeah. Yeah. Exactly.
No, I mean, no, honestly, and just anything.
Yeah.
It doesn't have to be anything, especially for the ages.
Yeah. No. I kind of like we've said before, it's an unprecedented set of circumstances. And I hope we can look back and find that we've found more common ground than less common ground when this is all over. I hope we have a better sense of trust for one another. And I hope people learn about pandemics so that we can respond more effectively in the future, and because this certainly is not going to be the last one. And so I really hope we look back and when this is all broken down and pieced apart, that we say, wow, we did some things really well, and that we can recognize that we really messed up on some things, and that we can all learn from that. But hopefully we look at it as a point in our history that, kind of a pre 9/11, post 9/11 scenario. I mean, you almost wonder if that's what it'll be, pre-COVID and post-COVID. You really wonder, and that we see the post-COVID world as better than it was before.
I hope so. I sure appreciate your time and your candor.
Yeah. Yeah, absolutely.